Anemia is a condition that affects the blood, causing a decrease in the number of red blood cells or a decrease in their ability to carry oxygen. There are several causes of anemia, including iron deficiency, vitamin deficiency, chronic diseases, and genetic disorders. Common symptoms of anemia include fatigue, weakness, pale skin, shortness of breath, and dizziness. To diagnose anemia, doctors may perform blood tests to measure the levels of red blood cells, hemoglobin, and other related parameters. Treatment for anemia depends on the underlying cause. It may involve dietary changes, iron supplements, vitamin supplements, or other medications. In severe cases, blood transfusions or other medical interventions may be necessary. It is important to consult a healthcare professional for proper diagnosis and treatment of anemia. Remember, anemia can have serious health consequences if left untreated, so early detection and management are crucial. If you suspect you may have anemia, seek medical advice to understand your condition better and receive appropriate care. Stay informed, take care of your health, and remember that anemia is a manageable condition with the right medical support.
Anemia is a medical condition characterized by a decrease in the number of red blood cells, RBCs, or a decrease in the amount of hemoglobin in the blood. Hemoglobin is a protein in red blood cells that carries oxygen from the lungs to the rest of the body. When the level of hemoglobin or red blood cells is lower than normal, the body may not get enough oxygen, leading to various symptoms. There are several types of anemia, each with different causes. The most common types include iron deficiency anemia. This is the most common type of anemia and is often caused by a lack of iron in the diet, poor absorption of iron, or chronic blood loss, such as from heavy menstrual periods or gastrointestinal bleeding. Vitamin deficiency anemias. Deficiencies in certain vitamins, such as vitamin B12 and folic acid, can lead to anemia. These vitamins are essential for the production of red blood cells. Hemolytic anemias. In these types of anemias, red blood cells are destroyed faster than the body can replace them. It can be caused by various factors, including inherited disorders, autoimmune conditions, or certain infections. Aplastic anemia. This rare type of anemia occurs when the bone marrow fails to produce enough red blood cells. It can be caused by genetic factors, certain medications, or exposure to toxic substances. Chronic diseases. Some chronic diseases, such as chronic kidney disease, inflammatory disorders, and certain types of cancer, can lead to anemia. Common symptoms of anemia include fatigue, weakness, pale skin, shortness of breath, dizziness, and cold hands and feet. Diagnosis typically involves blood tests to measure hemoglobin levels, red blood cell count, and other parameters. Treatment depends on the underlying cause of the anemia and may include dietary changes, iron or vitamin supplements, medications, and in some cases, more advanced medical interventions. It's important for individuals experiencing symptoms of anemia to seek medical attention for a proper diagnosis and appropriate treatment. The specific approach to treatment will depend on the type and cause of the anemia. Causes. Iron deficiency, the most common cause of anemia worldwide, often due to inadequate dietary intake, poor absorption, or chronic blood loss, example, menstruation, gastrointestinal bleeding. Vitamin deficiencies, lack of vitamin B12, folate, or vitamin C can impair red blood cell production. Chronic diseases, conditions like chronic kidney disease, inflammatory disorders, and certain cancers can affect the production of red blood cells. Genetic conditions, some inherited disorders, such as sickle cell anemia and thalassemia, can lead to anemia. Bone marrow disorders, conditions affecting the bone marrow, such as aplastic anemia or myelodysplastic syndromes, can result in reduced red blood cell production. Symptoms. Fatigue, feeling tired or weak is a common symptom. Pale skin, anemia can cause paleness, particularly in the face, palms, and nail beds. Shortness of breath, reduced oxygen carrying capacity of the blood may lead to breathlessness. Dizziness or lightheadedness, insufficient oxygen to the brain can cause dizziness. Cold hands and feet, poor circulation may result in extremities feeling cold. Headache, insufficient oxygen delivery to the brain can cause headaches. Irregular heartbeat, anemia can lead to a rapid or irregular heartbeat. Diagnosis. Blood tests, hemoglobin and hematocrit levels, along with red blood cell indices, help diagnose anemia and identify its type. Peripheral blood smear. This microscopic examination can reveal the size, shape, and number of red blood cells. Serum ferritin and iron studies. These tests help determine if the anemia is due to iron deficiency. Vitamin B12 and folate levels. Assessing these levels helps diagnose anemia caused by deficiencies. Bone marrow biopsy. In certain cases, a sample of bone marrow may be examined to identify the cause of anemia. Treatment. Iron supplements. For iron deficiency anemia, oral or intravenous iron supplements may be prescribed. Vitamin supplements. If the anemia is due to vitamin deficiencies, supplementation with B12, folate, or other vitamins may be recommended. Blood transfusion. In severe cases or during acute episodes, a blood transfusion may be necessary to rapidly increase red blood cell levels. Treatment of underlying conditions. Managing chronic diseases or addressing factors contributing to anemia is essential. Erythropoiesis-stimulating agents. These medications stimulate the production of red blood cells and may be used in certain cases. It's crucial to consult with a healthcare professional for an accurate diagnosis and appropriate treatment plan tailored to individual needs.
The concept of the blood type diet suggests that your blood type may influence how your body responds to certain foods and nutrients. This theory was popularized by a naturopathic physician named Dr. Peter D'Adamo in his book Eat Right for Your Type, published in 1996. According to this theory, each blood type, A, B, AB, and O, has specific dietary recommendations that can promote health and prevent disease. Here's a general overview of the blood type diet. Blood type O. Considered the ancestral blood type, associated with a hunter-gatherer lifestyle. Recommended diet: high-protein diet with lean meats, fish, poultry, fruits, and vegetables. Dairy, grains, and legumes should be limited. Avoid wheat, corn, dairy, and beans. Blood type A. Recommended diet: plant-based diet with plenty of fruits, vegetables, grains, legumes, and fish. Limited meat intake. Avoid red meat, dairy, and overly processed foods. Blood type B. Recommended diet: balanced diet including meat, dairy, grains, vegetables, and fruits. Certain meats like chicken and turkey are suggested to be better tolerated than red meat. Avoid wheat, corn, lentils, peanuts, and chicken. Blood type AB. Considered to be a newer blood type and a blend of blood types A and B. Recommended diet: a balanced diet with a mix of foods recommended for blood types A and B, including lean meats, seafood, dairy, and plenty of plant-based foods. Avoid red meat, kidney beans, and lima beans. It's important to note that the scientific basis for the blood type diet is controversial. While some people claim to have experienced benefits from following this diet, scientific research supporting the specific claims and recommendations is limited and often contradictory. Individual responses to different foods can vary widely, and other factors such as genetics, lifestyle, and overall dietary patterns likely play a more significant role in health outcomes. Before making significant changes to your diet based on blood type, it's advisable to consult with a registered dietitian or healthcare professional who can provide personalized and evidence-based recommendations tailored to your specific health needs and goals. Foods to limit. If you're looking to maintain or improve your blood health, it's important to focus on a balanced and nutritious diet. Here are some dietary recommendations to consider. Sodium and processed foods. High sodium intake can lead to high blood pressure, which is a risk factor for various cardiovascular issues. Limit your consumption of processed foods, fast food, and heavily salted snacks. Added sugars. Excess sugar consumption can contribute to weight gain, diabetes, and other health problems. Limit sugary beverages, candies, and foods with added sugars. Saturated and trans fats. These fats can raise your cholesterol levels and increase the risk of heart disease. Limit fatty cuts of meat, full-fat dairy products, fried foods, and commercially baked goods. Red and processed meats. Diets high in red and processed meats have been associated with an increased risk of heart disease and other health issues. Choose lean protein sources like poultry, fish, legumes, and plant-based options. Alcohol. Excessive alcohol consumption can negatively impact your liver and overall health. Limit alcohol intake to moderate levels, following recommended guidelines. Caffeine. While moderate caffeine consumption is generally considered safe for most people, excessive caffeine intake can lead to issues like elevated heart rate and blood pressure. Be mindful of your caffeine consumption from sources like coffee, tea, energy drinks, and sodas. High glycemic index carbohydrates. Foods with a high glycemic index can cause rapid spikes in blood sugar levels. Limit white bread, sugary cereals, and other refined carbohydrate sources. Opt for whole grains and complex carbohydrates instead. Excess vitamin K. If you're taking blood-thinning medications like warfarin, you may need to limit your intake of vitamin K-rich foods, as they can interfere with the medication's effectiveness. These foods include leafy greens, broccoli, and Brussels sprouts. Salt substitutes. Some salt substitutes contain high levels of potassium, which might be problematic for individuals with certain health conditions. Consult with a healthcare professional before using salt substitutes. It's important to note that individual dietary needs can vary based on factors like age, health status, and medical